Good morning, and thank you to the SAGES organization for the opportunity to present today. My name is Anna Chee. I'm a second-year medical student, and our study is titled Patient Engagement in a Virtual Patient Navigation Platform. Our research team has nothing to disclose. I'll start with some background information for our study. As I'm sure you know, there are extensive medical and insurance-mandated requirements that patients must meet to qualify for bariatric surgery. This process can take 6 to 9 months, and studies have estimated that preoperative attrition rates are somewhere between 45 and 60%. Looking at this, you can see that it's important to invest in strategies for keeping patients on track to progressing to surgery. And this is where virtual patient navigation platforms in the form of mobile apps may be of use. In the field of bariatric surgery, there have previously been studies that have looked at the use of mobile apps in guiding patients post-operatively, but there have been no studies that have looked at the use of mobile apps in the preoperative period. Realizing this gap, our group developed an app designed to guide patients through the preoperative workup to bariatric surgery approval, and the aim of this study was to understand the characteristics of the patients who engaged with that app and determine their impressions of its usability. The app in this study was designed in collaboration with the company SeamlessMD, and it was again designed to guide patients through the preoperative workup to bariatric surgery in a manner that's tailored to their specific health needs. I'll show you some screenshots from the app to give you a better sense of what it does. Firstly, providers will input patient-specific preoperative requirements into their profiles when they sign up. Next, patients will be prompted to complete monthly surveys to track their progress to surgery. For example, if their provider said that they need to go to a dietitian appointment, the app will ask them if they went. If they indicate yes, they'll be asked when they went, if they needed to reschedule, and if they encountered any other barriers. If they said no, then the app will just re-ask that question the next month. Patients also have free access to educational materials in the app. Okay, so recall that the aim of this study was to understand the characteristics of the patients who engaged with this platform and determine their impressions of its usability. To do this, we started by using the EMR to retrospectively collect socio-demographic and medical information on patients who were enrolled in the third version of the app, which was launched March 1st of 2021 after 3 years of development. Next, to understand patient impressions of usability, we asked patients to complete the System Usability Scale survey if they had engaged with the application, or tell us why not if they didn't engage. The System Usability Scale survey that the engaged patients completed is a validated survey tool used to assess the perceived usability of a design system. It's comprised of 10 statements to which patients indicate their level of agreement on a 5-point Likert scale. We wound up enrolling 92 patients in this study. We were able to reach 65 of them for the telephone surveys. Of those, 30 engaged with the application, and those were the ones that completed the System Usability Scale survey, and 35 did not activate and/or use the application, and that was the not engaged group, and we asked them open-ended questions about why they didn't engage. When we compared the baseline characteristics of the engaged versus not engaged patients, the only significant difference we found was that the engaged patients were more likely to have private insurance. And there were no other significant differences in the socio-demographic variables you can see here, or medical comorbidities, or chosen procedure type. Next, we looked at the results of the System Usability Scale to get a measure of perceived usability from the perspective of the engaged patients. Here you can see the 10 statements that are on this survey, and there was a high percentage of agreement with the positive valence questions and a high percentage of disagreement with the negative valence questions. The System Usability Scale has a scoring protocol, and when we followed that, we saw that this application had a median score of 86. The way that System Usability Scale scores are interpreted is by converting them to a percentile rank and plotting them on this curve that was created by Jeff Sarro. He created this curve from hundreds of previous studies that have used the System Usability Scale, and you can plot your platform's score and percentile ranking to see how it compares to previous platforms that have used this scale. And that way it's somewhat similar to a pediatric growth curve, for example. When we did this, we saw that our platform fell close to the 97th percentile for usability. Next, here are the thematically grouped reasons that the not engaged patients gave for not activating or using the application. These are the top 3 reasons. So the most commonly given reason was being too busy. For example, one patient said, life is very busy, don't like any more apps in my life, last thing I'm thinking about when thinking about weight loss. The second most commonly given reason was just not being interested. One patient said, I got the phone notification but didn't want to have the application. And the third most commonly given reason was being unsure about the purpose of the app. There are several limitations to this study. First of all, it has a retrospective cohort study design and doesn't therefore provide the highest possible level of evidence. Secondly, it was conducted at a single academic medical center and has a small patient cohort. And we also had missing data from 27 patients who we couldn't reach for the phone surveys. Next, there could have been variability in the way that the virtual platform was initially described to patients in clinic. And lastly, while the system usability scale is very useful for getting a measure of perceived usability, it's not additionally intended to diagnose any specific usability problems. In summary, this is the first study to our knowledge that looks at the use of a virtual platform in guiding patients through the preoperative workup to bariatric surgery approval. The users of this platform were more likely to be insured through private payers, and they gave the app high usability rankings. In fact, it ranked at the 97th percentile for usability on the system usability scale curve. The top 3 reasons that patients gave for not engaging in this application were being too busy, just not being interested, and being unsure about the purpose of the app. I'll wrap up with future directions. First of all, we want to increase patient engagement with this application by targeting the modifiable reasons that patients gave for disengagement in this study. Secondly, this study showed that the engaged patients were more likely to have private insurance. While there were no other significant differences in the socioeconomic variables or medical comorbidities that we looked at, that doesn't mean they don't exist. Our study had a small sample size, and so the next step would be to look at a larger data set. I'd like to thank the Ohio State University College of Medicine and Center for Minimally Invasive Surgery for their support of this project. And thank you very much for listening. I'd be happy to take any questions.